I'll need one. There's mine. Oh, good. Yes. Oh, giant. I love it. I love it. My son. Oh, there's yours. Good. Water. All good. This is all great things. Great to have your favorite beverage alongside you. Mine is water, and I also have coffee because caffeine is a very powerful antioxidant. It helps with swelling under the eyes. So I also had green tea earlier today, which is a powerful antioxidant. So chat with me and tell me what you guys are all drinking and where are you guys from? We're going to wait a couple minutes for everyone to join. But I want this to be very interactive. So feel free to find that chat box button and just say hi. Let me know where you're from. Well, hello, Kay Bonderud from Concord, California. Thanks for joining us. Water, yep.
Janine, I'm from
Hello,
Benicia.
Francie. Also from Concord. Good, we've got 2 Concords in the house. That's great.
I'm Janine, I'm from Benicia.
Hi, Janine. Thanks for joining us. Thank you. How's the weather out there? It's really hot over here.
It's hot.
Oh my God.
It's hot. Not as hot as Contra Costa, but it's hot.
Yes, yes. Well, I hope you guys are definitely staying hydrated. I'm glad to hear that you are. And I'm glad to see that we've got women and men on the call, because we're going to also highlight some of the men too. Hi, Angelica from Napa. Traveling nurse from Florida, staying in Sacramento. Well, welcome. Thank you for being here. Thanks, Tyson.
Hi, I'm Marcy from Pleasanton.
Hi, Marcy from Pleasanton. Welcome. Thank you so much for being here today. I really appreciate you guys coming today. And I mean, you guys can be doing so much other stuff, but you guys decided to come and educate and learn. So kudos to you. I'm really proud of you. And I also have my little lip shirt on. I don't know if you could see it, because we're going to be talking about fillers of lots of different things. Hi, Liz from Oakley. Thank you for being here. Okay, well, we're getting a few more people settled. I'm going to start. I just want to make sure everybody stays on mute so everybody can hear me. And I'm going to also be sharing the stage in a little while with Maria, who is our formulation expert, who's going to go over some of the skincare. And then we have Elaine joining us to help us with some of the technology issues, because I'm not so good with that. And that's a lot for me to handle. So I've got some backup there. So I apologize in advance for any technical issues. Okay, wonderful. What's so exciting to see your faces and so excited to see everybody here joining us. I'm going to go ahead and start to share my screen. Okay, Janine, can you see this?
Yes, I can see your screen.
Wonderful. Okay, great. Thank you, guys. Okay, so we're going to go ahead and get started. Like I said, I want this to be highly interactive. I want you guys to bring your questions, bring anything that you have on your mind, questions about fillers, things that you may have heard, questions about skincare. This is sort of the forum to talk about a few things. If I don't get to your question, I promise we will get to them and call you or reach out to you in some way. I want to make sure you get all the education that you need. And then also, I'm really interested to hear your feedback. So at the end of this, I'd love to get your feedback in the chat box. Let me know if you learned something. Let me know what you would want on future events. We've been doing this on a monthly basis, a monthly virtual webinar, because we can't do in-office live events. This is the next best thing. And so far, people have really liked it and enjoyed it and learned a lot of information. And so I'm so happy to do that, as long as it's helpful for you guys. So your feedback really helps me. And if there's any topics you want to know about in the future, I'm more than happy to be on next month and talk about some of the hot topics for you. Okay, so welcome. I hope you guys are staying safe and healthy. I'm Dr. Sonia, a board certified dermatologist. Like I said, I've been doing monthly virtual webinars and will continue to do so. I really love teaching. I love educating my community. If you haven't seen us already, we've been on Cron, we've been on CBS, we've been on The Doctor Show, and we're always talking about some of the latest, most innovative procedures. And my main real goal for you is always to learn facts versus myths, and to try to give you good information, the right information, and debunk some of the myths and the misinformation that's out there. So my background basically is I received my medical degree from Penn State in 2002, completed residency in 2006. So I've been in training for 24 years before I got to open up my own practice, Elite MD. I love teaching. I love writing books. We write books on skin of color. We write books on aesthetics. I've been an international speaker. I've taught all over the world. I used to teach at UCSF. I really enjoy mentoring high school students and medical students. I'm currently on a task force that promotes women in STEM, so science and medicine, as well as diversity among my field. I'm also a mom of 2 beautiful kids, and I practice with my husband, who is a board certified plastic surgeon. We are both co-founders at Elite MD, and he loves teaching probably even more than I do. So if you ever get a chance to see him, super passionate about teaching, mentoring. We both love the art of aesthetics, as well as the chemistry, really, of formulating skincare products that we're going to talk to you about today. And so a little bit about Elite MD. We really believe in skin health. That's the first main priority. We believe in, basically treating you inside out as well as outside in, a full holistic 360 approach. But at the end of the day, it all starts with doing the basics. And a lot of times we're just not doing the basics. And that's really what I want to stress today, is do the basics. At Elite MD, we're going to give you options that's going to be right for you, that's going to be safe for you, it's going to be effective for you, and it's going to be, most important, natural for you. We're the office that's going to bring you natural, cutting-edge information and technology and information procedures. We're going to offer a diversity of options. It's going to be inclusive of all skin colors, all skin types. So it's really important for us that you're comfortable, that you trust us. And that's really why we've been able to see patients from all over the world, from 6 continents, 25 countries, 49 states, because we really incorporate this team-based approach. For me, it's always going to start with the basics skincare. You're going to probably be seeing my esthetician at some point for helping with peels and microdermabrasion and helping our dermatology procedures work better. And so why is that all important? So my approach when it comes to any procedure that I do, I call it the 4 Ps to pretty skin. What are the 4 Ps? So the first P, I don't touch a patient until the first P has been met, and that is prime your skin. We want you to be on the best physician grade, medical grade skincare possible. That's where the investment starts. It doesn't do any good for me to do a procedure if you're not on a good medical grade skincare sunscreen, or you're not on a basic vitamin A medical grade retinol. That's where the information comes. So if you do your part at home with medical grade skincare, then my part actually looks a lot better. So number 2, prep your skin. P is for prepping your skin. This is where you're going to probably see one of my estheticians. She's going to help peel and exfoliate very gently all those dead skin layers, that top layer of skin that's glued in, that doesn't allow for skincare to penetrate, that doesn't allow for lasers to penetrate, that doesn't allow for the procedures that we do to really penetrate. And only after you've done that, then we can do the procedure. And then in my hands, in my board certified nurse practitioner's hands, it just works that much better to give you the results you're after. And then the final P is to protect your skin. Protect your investment with the best medical grade skincare that's right for you based on your goals and your problems. We want to keep your skin as healthy and glowing and luminous as possible. So if Barbie ever came out with a 60-year-old version of her, this is probably what she would look like. This is the number 1 top concern of my patients. They come in with a series of complaints about things that they've noticed, literally One day, looking in the mirror, they start noticing drooping eyebrows, eyelids that are starting to sag, the tear troughs, the under eye area, the hollowness under there. There's loss of cheek fullness, the smile lines, the marionette lines, the jowls. All of these things start to take hold because of the aging process. And that aging process starts very, very young. And people don't realize in your 20s, you lose 1% of collagen a year. By the time you reach menopause, 35% of collagen is gone. That's a lot. And so what does that mean? There's a difference between what aging skin or wrinkled skin will look like compared to a healthy, younger skin. So what are some of the changes that we see? Well, in all levels of our skin, our top layers are epidermis, our next layers are dermis, and the final layer is fat. Our epidermis has thinned out because of the sun damage, because of the lifestyle, because of diet, because of stress, because of sun. That's the number one thing, is the sun. That epidermis is thinned out. What do you start noticing? Lines, some brown spots, maybe precancers, maybe skin cancers. You've got maybe a history of it or a family history of it. The next layer is your dermis, that bouncy layer. That's what gives that little bounce to your skin. As we age, that bounciness falls off. That's where all of your collagen is, your elastin, your hyaluronic acid. All of those supportive structures, that thick, beautiful dermis is now half of its size, so that there's less collagen, less hyaluronic acid, less elastin. And then the vasculature also, the nutrients going to your skin is much slower. There's less vasculature. So as a result of that, you just kind of have this sort of dried up skin, thin skin that's really susceptible to damage. Underneath there, you have fat layer that's thinned out, and you have your muscle layer that's also disintegrating, and under there you've got your bone loss as well. So if you've got osteopenia, osteoporosis, it's twice the battle, because all that supportive structure is lost. And guess what? Then gravity starts to take hold. And once gravity takes hold, then really it's a much more difficult problem, because that's when only surgery is going to help you. So we're going to talk about what some of these options are to kind of turn back the clock, to help you, rejuvenate you, to make you feel and look fresh, but still very natural. So we're going to talk about the fillers first. First, we're going to go through the fillers, and then we're going to go over medical grade skincare. So we have options for everyone. So when it comes to fillers, there's a lot of different sort of areas that people will complain about. Many people say, well, people think I look angry or I look tired because they start noticing forehead lines, forehead wrinkles, deflating, sagging brows, hollowness in the temple area. Actually, people don't notice how hollow their temple goes with time. The crow's feet around the eye area, the smoker's lines, or maybe you've never been a smoker and you just starting to notice all these lip wrinkles all around your mouth. They're called smoker's lines, smile lines, the marionette lines, the cheek and cheekbones. So the structure and the contouring of the face, where in your 20s you have a much more, what we call an inverted triangle, more fullness in the mid-face, has now reversed. You've got now all of that dropping and kind of giving you a heavier lower face. And that's what causes a whole contouring shift between somebody who's in their 20s and somebody who's in their 50s. So when we talk about fillers, that's different than Botox. Botox, Dysport, if you've heard of them, they're basically around to help relax muscles. Fillers are around to fill in lines and wrinkles. So when we're talking about the top third of your face, your forehead, your crows, that's where Botox is most appropriate. In general, that's where we go to first. When we go to the mid face or the lower face, we're talking more about filling in lines and wrinkles, or helping to recontour the face to give you your youthful shape back, to give you that inverted triangle back. So there are two categories that we're going to discuss a little bit more in detail. When it comes to fillers, so very commonly, it's been used for the smile lines, the marionette lines. The older women will have these lines around their mouth. They say when they put on their lipstick, it tends to creep into those lines. They hate it. So by filling some of that in, their makeup actually goes on nicer and smoother. Lip filling, lip augmentation, fullness in the lips is another area that people are really interested in. But you know, other areas for contouring are jawline. Jawline for both men and women. Chin augmentation. You no longer have to have surgery for that. You can actually augment the chin by putting in a filler. You can also do what we call non-surgical rhinoplasty. Put a filler in the nose to help reshape it. It's done in 15 minutes without any downtime. You can also help with acne scarring. So people who've had acne and now are just left with all these pits, we can actually fill those in with a little filler. And then the temple area, you know, an overlooked area is usually the temples where they get a lot more hollowing. So we basically help to recontour that face into that youthful shape again. Okay, can you guys tell on this first picture? Her left side is a lot more wrinkled than her right side. Can you guys see that? And why is that? We all have some asymmetry when it comes to the aging process. The driver's side of the face tends to get more sun, and therefore it tends to get more lines and wrinkles and hollowing and brown spots. So if you start looking at your face, you'll start noticing there's a difference between the left and the right. And that's why, because lifestyle matters. So somebody who also sleeps on one side of their face over the other will probably have more lines and wrinkles. Remember, genetics is a huge part of this as well. And then sun. So here's somebody who's in her early 30s, maybe late 20s. But if we take a little UV camera and take a look under the skin, guess what we'll find? Lots and lots and lots of sun damage. Kind of scary, because she is going to be at higher risk for developing precancers, skin cancers, and then lines and wrinkles. So when it comes to fillers, again, we're trying to fill in lines, wrinkles, add back some of that natural volume to the face. Generally, we're using a very, very natural product such as hyaluronic acid-based fillers. That acts like a sponge. If you think about it as a sponge, it absorbs all this water and it plumps up the skin. So it's great for plumping and smoothing the lines and wrinkles. There's also calcium-based fillers that we'll use more for structure. We're really building the jawline out, for instance. We need a little more structure. Age matters. So my 30-year-olds are coming in asking for something for a different reason versus my 40s, 50s, or my 60s and 70s. 30s, they're all about prevention. They want contour. They want the cheekbones filled. They want the Instagram photo. They want the fuller lips. So we're guiding them in a different way. 40s and 50s, this is where the lines and wrinkles have formed. So we're treating and softening some of the facial lines and wrinkles. And my goal for them is to delay surgery. I don't want them to have surgery unless they need it. So if I can do these small little tweaks, these small little maintenance treatments, every year or so, then hopefully we can delay surgery. My husband may not like it. He's my board certified plastic surgeon, but that's really my goal for you. That's my honest opinion. That's my honest belief, is that I want to do everything I can to protect their skin, help their skin health, and delay surgery. Now, 60s and 70s, they're coming in. They probably are coming because they want the non-surgical options, even though they probably need surgery, but we still have options for them. And a lot of times, maybe they've gotten their facelift, but they want to combine it for the best results. So a facelift's going to help correct their jawline, but it's not going to correct the lines around their mouth. So a lot of times we're combining the fillers and the Botox along with even a facelift, because a facelift's not going to touch every area and help with every line and wrinkle that bothers them. And the general rule is, how much do we use? It's about 1 syringe per decade of life. So if you want a good result or a natural result, that one little syringe is only about 1/5 of a teaspoon, 1/5 of a teaspoon. 5 syringes make up 1 teaspoon. That's a small amount. But what we try to do is basically use very small little micro droplets all around the areas that bother you. So if you are 50 years old, chances are you're going to do best with around 4 to 5 syringes. So some people may get scared away. Wow, that's a lot, isn't it? But it really isn't. It's a really small amount. They're micro droplets, and they're used in a very, very specific manner to give you a very natural result. So just keep that in mind. So again, we're volumizing, we're contouring, but we're also filling. And we're generally filling the mid face, the lower face. We're contouring. We're helping to rebuild structure that's been lost. We're helping that jawline. We're helping the nose. We're helping to create more lip fullness, more volume in a very controlled, very natural way. So this poor girl has these pen marks all over her. Why? Because these are all the vasculature that is found in the face. So underneath all the injections, we cannot avoid every single vessel. It's impossible. And everyone's anatomy is also very different. So guess what the side effects are? Side effects I always go over is going to be, there's going to be temporary side effects that everyone will have. That's going to include some redness. It's going to include maybe a little mild discomfort. It's going to include a little swelling, maybe for 24, 48 hours. And it can include bruising. Why? Because if you get bleeding, you will get bruising. And guess what? We cannot avoid every single vessel here. So not a big deal. You go through a vessel, you know, get a little bit in through a vessel, you get a little bleeder, no big deal. You'll just get a bruise. Bruise will go away. What are some things you can do to mitigate that, to lessen that? Try to discontinue any blood thinners like fish oil, alcohol, aspirin, ibuprofen, things that are going to increase your bruising risk. You can actually, after the procedure, take arnica, pineapple juice, bromelain. We'll recommend that after surgeries as well. That'll also decrease the time of bruising. And then I've got some that are just poor healers, just from their medical history, that might take up to, you know, maybe even a week or so to heal and help the bruising. So that's just a normal kind of temporary side effect that we recommend for everybody. Certainly you can wear makeup and camouflage to cover it up, no problem. Other, you know, side effects we talk about are little nodules, asymmetry, all of it goes away, but there are areas that are going to be a little more higher risk than others. So it's so important to always, always see a trained and experienced injector, because if you don't, you will get into problems. And we have seen problems and complications and side effects from other offices that we have to treat. And they're not easy and they're not fun. So it's really important that wherever you end up going, you always want to do your research. Okay, just some before and after pictures here. Let you know that we can, again, lift and contour. This is a 2-year filler to help with that cheekbone. So if you see that little nice, beautiful curve that we were able to create in the cheek contour before and then after a month, and it's sustained even 2 years later. Now, does that mean I don't see them for 2 years? No, we still see them back at half that time, about a year, to do a little touch up, because we don't want all of it to be gone. We want to actually work with what's still there. So I still tell people to come in about half the time for a touch up. So younger patients can get this done to help just mitigate some of the lines and wrinkles. This is somebody who's getting it done for the smile lines, very natural. Somebody who is in their 60s getting it done, you can see around the eye area as well as the jaw area. Just helps to soften the lines and wrinkles that she's got in her cheek fold. Again, the smile lines around what we call the nasolabial fold and around her mouth, just softer. Again, it still looks like her. She's still herself, but she just looks like a refreshed version of herself. So people might say, oh, you look rested, you look happy, you look less stressed. And that's what we're after, not, wow, who's your plastic surgeon? That's not what we're after. We're after a good natural look. And with her, you can see a big difference in that frown line there and her smile lines as well, really nice and softened. Again, on the cheek area, just softened up that little line there, helps with just overall volumization, overall just natural, younger looking skin, younger look. A lot of people actually feel younger than they look, and so they like to match their inner and their outer appearance. We're not trying to go after every line or wrinkle. We're not trying to erase every single line or wrinkle that they have. We just want to soften them. We still want them to look their age, but the best version of themselves at that age. Skin of color we can certainly do as well, because that's also another complaint, is the aging process, so helping with lines and wrinkles there. Again, skin anatomy is a little bit different in terms of skin of color, so it's really important always to make sure to see an experienced injector. Somebody who's younger, getting the lip done just for that little natural fullness. This is immediately after injection, done with the cannula technique, but you can see she looks great, very natural, very little swelling. I mean, she's still swollen in here, but she can really go out, you know, during a lunchtime procedure and nobody has to know that she had anything done. So she'll probably be icing and sort of relaxing the rest of the day. No alcohol today. Somebody who's younger who just wants a little extra lip fullness, a little pillowy, a little hydrated look, helps to give that. and then somebody who's got more of these smokers lines that we were referring to, a combination treatment is always going to work best for these patients. So are they just coming in for a syringe of filler to fill in a line or a wrinkle? No. They're probably doing a little laser resurfacing. They're probably doing a little Botox around there, and they're going to fill in some of those lines and wrinkles. And you can see from that downturning frown, we now have more of an upturned angle of the mouth. And those lines around the mouth are now softened. And we can combine it with the laser because we're also helping to reproduce that lost collagen that we were talking about. So we've got collagen that's being stimulated, and we've got hyaluronic acid from the filler being injected. And you can see just a softer look, same patient there. Again, she still has lines, but they're just softer, more refreshed. Men get it done as well, smile lines. Here's the jawline. And again, 4 syringes is not uncommon. This is a normal amount that's usually done. So a lot of people, like I said, will get scared. Is that going to look unnatural? Is that going to look is that going to change the way I look? And the answer is always no, but we do need product to be able to do the final outcome of what we're after. So an older gentleman who's getting it done, same thing, he's lost a lot of collagen there. You could see the furrows and the deeper folds there, but what a difference, really nice, and all without surgery. Didn't have to undergo any surgery, little downtime, lunchtime procedure. Here's a staff member of ours who wanted to get it done for the under eye hollows and the dark circles. Very active, he's obviously working every day with us, but he didn't miss a day. Got his procedure done, didn't get any bruising, did a little cannula technique, was at work the next day. Just did a little ice, maybe a little arnica, and he's good to go. Nasal reshaping, really cool. You don't need to have surgery done. Put a little pop of filler in there, 15, 20 minutes, you're done. Very little downtime, and the filler will last up to a year. So just a little note on Botox and Dysport as well, because a lot of times these are combined treatments. Botox, Dysport, it's like Botox was sort of the first rodeo in town, then Dysport came out as the newest rodeo in town, and now there's even Xeomin. So again, they all work the same way. It's just, do you like Coke or Pepsi? They work to relax lines and wrinkles, mainly of the upper third of the face, but we can use it also for the TMJ, so people who've got grinding at night or have to wear mouth guards. We could use it for lines around the mouth. We could use it for like a little gummy smile. We can bring that down. We can upturn the nose with it. We can help with the little necklines as well to give a little mini lift. We can also use it for excessive sweating, underarm sweating. That's another great use of Botox, is putting some under the arm. Works really, really well there. So there's a lot of great uses for Botox. Also, I should say with the fillers, other off-facial uses are the neck and the décolleté and the hands. A lot of people actually fill the hands, especially if you've got that crepey skin where you've got a lot of vessel show. It's wonderful for the hands. It was FDA approved actually a couple years ago, so it works fantastic there. Remember Botox and Dysport, do you want Coke or Pepsi? They're both very similar products. When they ask me, what do you recommend? It's really a preference. They both work very similarly with very similar safety profiles. So just to show you that before, you can see the frown line, you can see the muscle activity. She got Botox done. After day 7, you could see the difference. She's able to move the muscles, but not as much. After day 90, you could see that she still got it in place. And then at day 120, that's when it's starting to wear off. So about 3 to 4 months is when you want to replenish your Botox or your Dysport. So about quarterly versus fillers about once a year, 1 to 2 times a year.
Right now, it's my Zoom. See, only problem.
So just to kind of help with misconceptions about Botox, some myths that I get a lot. Well, Botox is only for older people. I don't need it. I'm, in my 40s. I don't need it. A lot of my 30-year-olds are actually getting it done now for the preventative aspect. Oh, I've got a Botox cream. It works just like Botox. In fact, it says so on the bottle. No cream is going to do what injectables can do. It works immediately, very quickly, and it lasts. However, there are creams, which we'll get into, that do help to augment and make it last longer, but nothing is going to give you the results like Botox. Botox is expensive, doesn't have to be. You can actually lock in discounts. We have a great program called the Elite Club. You can lock in a discount year round, just get your Botox in every quarter, and we keep you on schedule. And the more you do it on schedule, the less Botox you need over time. It's addictive. It's a lifestyle, it's a choice. There's really no addiction to it. It's plastic surgery. This is not plastic surgery. There's no knives. There's no stitches involved. They're very small little doses. It's a simple 5-minute procedure. Most common thing I get is it's a toxin, it's poisonous, it's unsafe. This is actually a very highly purified protein made from a bacteria. It's actually safer than aspirin. Aspirin probably has more side effects than Botox does. It's painful. Don't need any numbing. It's like the smallest, tiniest little needle that we use, like a little mosquito bite. Even my men can get it done, which speaks volumes, without any anesthesia whatsoever. Do a little ice for maybe numbing, and that's about it. Botox is for models and celebrities. Nope, everybody gets it done. My CEOs get it done, to my teachers, to my moms. It makes the face unnatural, frozen. Well, it doesn't have to. In the hands of an expert, the results should be very natural. And I can't overstress, combination treatments always work best. So anyone who comes in saying they just want one syringe or one of this, we probably would send them elsewhere, because that's not who we are. What we want to do is give you results that we're after, that is effective, that's safe, and the combination will give you what you're after. So our happiest patients are always those that follow the recommendations and do the combination approach, rather than do one syringe and put in 10 places. You're just not going to see the results. Okay, guys, so I did a lot of talking and educating. I'd love to know if you guys have any questions so far before I let Maria take over. Elaine, are there any questions?
I have a question.
Yes.
So I was wondering if you could talk a little bit more to the filler under the eyes. How does it work?
Absolutely. So fillers are great for a lot of different areas, like we had discussed. Under the eye is wonderful for dark under eye circles, hollowness. People will, some people will actually have little fatty deposits under there and they're not ready for surgery. We're able to put some filler in there to give you that plumping effect. Also for lines and wrinkles, a very simple treatment out there. You might only need a syringe and, just a half on either side. We want to do small doses under the eye, but the idea is to give you a very natural look, to help with dark under eye circles, to help with lines and wrinkles, and to give you a very natural look. And actually under the eye, it lasts longer than other areas because it doesn't get so degraded with muscle activity. The areas that degrade faster are those where you've got a lot more muscle activity, such as the smile lines or the lips. So the added advantage under the eyes actually can last longer than the other areas. It's a great question. Thank you so much. Any other questions?
Okay, I have another here from Tyson. What
Tyson.
are your feelings about L-lysine as a supplement to preserve, augment collagen production?
That's a great question. I think there's so much new information and research that's being done in the oral supplement world. At this time, there isn't anything that I recommend myself yet for collagen orally, because it's very difficult to get enough oral concentration to actually penetrate into the skin. And that includes, antioxidants. That includes a lot of things that we eat. We get it for our gut health and our body health, but it's very difficult to actually get it for our skin health. So for me, I would rather it come from the outside in to get better concentrated, penetrated concentrations in your skin. But that's a great question. I think we'll have more research coming and we'll have more information coming with that. But at this time, there just isn't enough science for me to say, and I'm all very much science driven. So, but with that, it's a great segue to actually introduce Maria, who is our formulation expert, who helps with the formulation of our products. So she might be able to also speak on some of this as well.
Hi.
Yeah, come on in.
Thanks for having me. I'm Maria, and at one point I might turn off my video because my internet's a little unstable, and somehow when the video's on, it starts getting a little wonky. Anyway, so Dr. Sonia talked a lot about injectables, and this Sunday's my 56th birthday, so I'm a big fan of injectables.
Yay, happy birthday, Maria.
I'm also a huge fan of medical grade skincare. That's why I'm in this industry, because I believe that it actually makes a difference in your skin. And there's so many ingredients and delivery mechanisms that can get these ingredients into the skin that can preserve some of the natural function of the skin that we lose as we get older, and helps relaxes fine lines and wrinkles, lifts and firms the fibroblast in the skin so that we have a younger looking appearance. And if you are doing injectables and neurotoxins, amen to that. I'm right there with you. Augment it with a medical grade skincare that's going to support those results. And if you're either a purist and says, I'm not interested in that, we certainly have medical grade skincare that can be used topically that will help preserve what you have and replenish what you've lost. So Dr. Sonia, will you pop to the next slide? Great, okay. So Dr. Sonia spoke about the injectables, right? And big areas of concerns are the fine lines and wrinkles, loss of collagen, dark circles, puffiness, fine lines and wrinkles around the eyes, texture of the skin. I think that's the biggest issue, that as we start to age, that we notice that texture change in our skin. Lips, not only are lips kind of in vogue right now to have big, beautiful, pillowy lips, but as we age, they begin to thin. And then the crepiness of the skin, and something that I'm fighting hard for now is my neck. As we age, we're starting to see that crepiness and the loss of volume and elasticity in the neck. Maybe those, what are those muscles, Dr. Sonia?
Oh, the platysmal
Yeah.
bands?
Yeah,
Yes.
the platysmal bands.
Oh, those dreaded bands.
They're the worst. They
Yes.
become more prominent. So what can we do to support the overall efforts that we're doing as far as injectables, or slow down the aging process? So I'm going to talk, oh, sorry, I was going to flash forward. Can you go forward, Dr. Sonia? So I'm going to talk about some of my favorites, and please jump in, ask questions. I'm passionate, as you can tell, I'm sure, about not only skincare, but skincare that works. So one of my go-to products is the Firmalift and the DermaFilm. These are a peptide-based product that the Firmalift is working to work like a topical neurotoxin, and it's helping relax the expression movement in the skin. What we're using is a blend of peptides, and one of the peptides in this is acetohexapeptide 8. And in clinical studies, acetohexapeptide 8 in the 10% volume, so Dr. Sonia's Firmalift has 20% in the 10%, it shows to reduce fine lines and wrinkles by 30% in 30 days. I mean, just, that's massive. And this is just going to help with the crepiness, firming and tightening, kind of lifting the skin. You're going to feel an immediate difference. But with peptides, peptides naturally occur in your skin. They're short chain amino acids, and they slow down in production as we get older. So this is just kicking it back into up to speed where it needs to be. So we need to keep that pressure on. So it must be used every single day to continue that pressure on the skin to reduce the fine lines and wrinkles. The DermaFill, think of that as your topical filler, right? So as we age, we start losing volume in our skin. We start losing that collagen. We have peptides in this, pentapeptide 4, which is stimulating our collagen production. We have something called the TGF-beta1 receptor, and that kicks up the collagen for us. This is kind of clicking that light switch and making that go into production again. So we're rebuilding our own collagen. It also has therapeutic levels of antioxidants. What are antioxidants? I think of those as an insurance policy for my skin. They're protecting against those free radicals that are damaging the cells and damaging the collagen. So we're kind of putting up a coat of armor on our skin, protecting against future aging. Hyaluronic acid, Dr. Sonia was saying that that's what we're using in fillers, right? We're just replacing the hyaluronic that's naturally occurring on our skin. With fillers, it's going into a very specific area where she's injecting it. But if we use hyaluronic on our skin, we're getting that overall plumping. And in particular, we want to look for a fractionated molecule of that hyaluronic so that we can actually get it to penetrate to the dermal layer where it actually occurs naturally. Ceramides replenish the barrier to our skin. Our barrier is necessary to lock the hydration in the skin and keep the irritants from the atmosphere out of the skin. And then live yeast cell derivative. If anybody, Tyson, you're a nurse, right? Did I get that right? Awesome.
Yes.
So you're probably familiar with this. Live yeast cell derivative brings oxygen to the cells and supports the oxygenation,
Oxygenation.
Thank you, the oxygenation of the skin. So it's helping our cells act younger and more healthy. So pairing the Firmalift, which is going to relax the fine lines and wrinkles, firm and tighten that dermal matrix. So it's going to give us the kind of a topical appearance of Botox, and then the Dermafill, which is going to be your topical filler. Using these in on their own are phenomenal. I wouldn't go a day without them, but using them in conjunction with your injectables is going to increase the longevity of your injectables, as well as giving you a better overall cosmetic appearance. Because when we're doing these injectables, right, they're very specifically placed in the skin. This is going to give you an overall more youthful appearance.
And Maria, these were hot items and no needles duo kit during the quarantine when no one could come in for their Botox and fillers. This kind of helped carry them through the quarantine phase, which was really great. So it helped extend what their Botox and fillers was already doing, or at least it gave them at least a gap of some sort of collagen stimulation in between before they can come in.
100%. Yeah. These are I will tell you the products that I seriously can't live without. And these two products I wouldn't miss for a day. Okay, the next item. So here is a example. This is 8 weeks use. Now, anytime we're using products, I know that we are a immediate gratification society. We want to see it right away. But the truth is, it takes, in younger skin, it takes about 27 days for a cell cycle. And as we get older, that actually slows down. So we want to really see 2 full cell cycles to see physiological change to the skin. Anything sooner than that is, really more on a cosmetic level. So the combination, here's another example. You can also see the redness in her skin, the inflammation in her skin has decreased using these products. This is because of the antioxidants. They're anti-inflammatory and vasorestrictors. Lips. Okay, lips are a big deal. Not only are they kind of cosmetically in vogue, but as I mentioned, as we age, they start to thin out. And lips really do attribute to that youthful nature of the face. So we can go in and we can have lip filler, which is phenomenal, and you can go all out, or you can just have them modified a little bit just to make it a little more age appropriate. But the Voluma Lip is a great product. Again, it's one of my go-to every day. This is immediately giving that plumping, that swelling of the lips. We're using niacinamide to do this. So we're creating that kind of natural plumping, and you'll see it's called rubification. It's a redness that happens to your lips. So you get that natural redness because the blood flow to your lips is heightened, and then that natural plumping. It has palmitoyl tripeptide 38 in it. This is a peptide that also stimulates collagen. So while you're seeing that immediate plumping to the lips, so immediate gratification, but cosmetic, it'll go away, the palmitoyl tripeptide 38 is actually stimulating your skin's natural collagen. So you're going to actually start building your own volume in your lips. It has both the large molecule hyaluronic and the fractionated molecule. So you're getting that deep penetration of hydration. And if we can get hyaluronic down to the dermal layer, we can actually start stimulating collagen again. So this is phenomenal. In a clinical study, you can read the results here, but patients saw that their lips were more defined, less fine lines and wrinkles. They looked fuller, volumized. I don't know, I'm not gonna make anybody raise their hands. If you've done lip filler, it's very common, and Dr. Sonia, I'm gonna have you back me on this. It's very common to get the filler, and because of that immediate swelling, the patient's like, oh, whoa, hold on, you did too much. And Dr. Sonia will say, it's just the immediate swelling, it'll simmer down. And then the patient calls 2 days later and says, you didn't do enough. So
Yes.
they miss that immediate volume. So this is a really great way to continue, one, to augment that volume, right? And get that beautiful kind of bee stung look that you get right after the injections. But with consistent use, it's going to reduce your trips back in to see Dr. Sonia for the filler because you're stimulating your own collagen. And you should start seeing that after about 6 months of use. So some before and afters, and then the clinical study was done after 4 weeks. All right, the Elite MD Eye Brightening Cream. So I think that eyes are oftentimes the first place that we see the aging process. It's a very thin skin, and that's where we see those fine lines and wrinkles, the vascular or dark circles, and puffiness. So Dr. Sonia has the Eye Brightening Cream. It's therapeutic. It's really addressing all of the concerns that we have with the eye area. All-trans retinol. It has the large and fractionated molecule hyaluronic for deep hydration. Niacinamide, which helps with pigment and firmness. Tons of antioxidants. So not only are we looking to repair the damage, but we're going to protect from future damage. A variety of peptides and ceramides. These are going to firm and tighten, as well as help with the lymphatic drainage around the eyes. Vitamin K and arnica, that's going to help with bruising and dark circles. Caffeine, that's going to eliminate puffiness, as well as help firm and tighten that eye area. Ideally, you would want to use this twice a day, once in the morning and once at night. But this will keep you out of Dr. Sonia's office for needing filler under the eye, because we're stimulating our own collagen. We're helping to prevent that trip there, repair the damage. And I will tell you that here's an example. Somebody just sent a question about dark circles. So this gentleman's Indian. He's also a DJ. So I think he keeps some pretty late nights. But you'll see the before and the after, the dramatic reduction of dark circles under his eyes after 3 months of use. We're also seeing, a relaxation of those fine lines and wrinkles, some lift and tightening around his eye. With more consistent use, you'll see even better results. Dr. Sonia, I didn't catch who it was, but Tyson,
Yes.
hydrocortisone and hydroquinone.
Yes, I would be very cautious there with that combination. The reason why is because you're dealing with a very delicate eye area. It's very thin skinned. And yes, we use hydroquinone. You do have to be careful with cortisone use, however. Hydrocortisone can thin the skin out with long-term usage. So I don't like cortisones if I don't need them. Generally, we'll use it to help with reducing irritation from things like retin-A, because a lot of times retin-A is in here. So I personally would be very cautious, and hydrocortisone can also cause eye injury and cataracts and bad things in the eye area. So I would rather you want a safer product that is hydrocortisone free. And definitely sunblock is going to be part of that picture, and potentially this product would be actually great for you. But I would steer very clear of long-term usage of cortisone because of the damaging effects, long-term and permanent damage of skin thinning.
do you have any feedback before we go on with my presentation? He's using a 6% hydroquinone under the eyes.
No, I would go very gentle. It's a delicate area. I go very, very slow, 2%, then maybe a 4% and very, some very, like tough cases, but I would not go higher than that. Face, I have done 6% and I still don't want you to go too high. I'm just worried about the eye area and the delicate nature there. The face is a lot more robust when it comes to these products, but the eye area is not as forgiving. So that would be my recommendation for you, is to switch that if you've been on that for a while. There is another also question about an eye cream with sunscreen. So exactly that. I want everyone to be using a sunblock with any cream that we're actually talking about, but especially for dark under eye correctors. A lot of people go after the dark circles, but they're not doing the most important part, which is the most basic part. Remember, I'm all about the basics. Is just wearing your sunblock every day, because that alone is going to help with negating the effects of the sun with the dark under eye circles. If you just wear an eye cream without sunblock, you're not negating anything. It's wasting money and your investment. So sunblock is the first step, and then a good eye cream is your second step.
All right, we'll do the next slide. All right, so Dr. Sonia just launched a brand new eye cream. Love this product. If you're familiar with La Mer, listen up. So the Elite MD Eye Brightening Corrector and Concealer is a blend of peptides and stem cells and sea kelp that is very similar to La Mer's Miracle Broth, yet the kelp within this product is medical grade, so it's using the purest forms. So the peptide blend is that acetohexapeptide 8 that I spoke of earlier that reduces fine lines and wrinkles by 30% in 30 days. It's in this product. So it's going to help with those fine lines and wrinkles, repairing that around the eyes. It has Edelweiss extract. This is actually classified as an antioxidant, but it won Innovation of the Year for its ability to lift, firm, and tighten. So you're getting all that gorgeous tightening and relaxing of the fine lines and wrinkles around that delicate eye area that really shows the age very quickly. The kelp extract, this is a blend of sea kelp that not only lifts, firms, and tightens, but provides micronutrients to the eye area to help with repair. It has the hyaluronic acid in it, both the large and the fractionated molecule. So you're getting that deep hydration and plumping of the fine lines and wrinkles around the eye. And then titanium dioxide. We use this as a universal pigment in this product. So this is your concealer, right? And the universal pigment really does blend with all skin types. I know that I applied it at first. You can see how pale I am. And I thought, oh, this is never going to match. And what it does is it reflects your natural pigment and diffuses the imperfections. It has a bit of a salmon color to it that helps negate the blue tones under the eyes as well. So it's a beautiful concealer. If you need something more, it also works as a beautiful primer to add the next layer of coverage on your eye. And then it has this really cool, ironically cool, it's a cooling applicator. And you will apply the product around the orbital zone of your eye with the applicator. This cooling applicator helps reduce the swelling and the puffiness around the eyes. So you can apply it and blend it in with that cooling applicator. So what's it do? It covers those fine lines and wrinkles, the blueness, the dark circles. The cooling applicator reduces the puffy, tired eyes. It conceals fine lines and imperfections, firms and tightens the skin, and is hydrating to the skin. So again, another option for if you decide not to have filler done under the eyes, or it can augment and complement it. Next slide.
And I love that product because I can do less foundation and less concealer with it. So I put that on, I have it on right now, and I just put that on and with a little dab of concealer on top, so it's less makeup coverage that's needed.
I actually love it because makeup, as I age, starts kind of settling into the fine lines or not so fine lines. This does not do that. So
Yes.
it always feels very fresh. All right, so neck. I was saying earlier that neck's my big complaint, right? So there are things that we can do to the neck. We can do fillers, we can do relaxers, but ultimately, whether we're filling it or relaxing it, we're still going to have that tone and texture that kind of gives away our age, that crepiness, the laxity, and you know, as we get older, the skin really starts to thin around the jaw and the neck and the décolleté. So this neck cream has the Edelweiss stem cell that we talked about in the eye cream that's lifting, firming, and tightening the skin. Peptides, which are also lifting, firming, and tightening. The LYCD, the live cell derivative that I was touting that I love is in this. So what this is really doing is firming, lifting, and tightening the neck area. Let's go to the before and after. Here's a great example of 2 weeks. Remember what I said earlier that we don't really see physiological change in the skin till after about 8 weeks. The fact that we saw a difference after 2 weeks is pretty dramatic. Here's another example. You look under her submental region, right under her chin, and you see kind of that, that lax skin there has tightened up, and those fine lines and wrinkles are starting to soften. Okay, this one's my favorite image. So this gal, I want to say she was early 60s, and far left, you see that lax skin, right? And far right, she looks like she has a neck of, you know, a 20-year-old in that. So it's that great lifting and firming. And this product also does have niacinamide in it, which is going to help reduce the appearance of the dark spots, which also kind of gives away our age. So these are the products that I would easily pair with or use instead of injectables.
Thank you, Maria. That's excellent information. Thank you for all that science and nerdy stuff is what I really love.
I know.
So I always learn something new about the formulas. Okay, guys, so on the interest of time, I do want to just finish up here. And if you guys have any questions, feel free to put in the chat box. Keep letting us know if you have any questions, if you've got any feedback, if you want to see anything in the future. I just want to close up with a few things that I want you guys to do. So we shared a lot of information, and I don't expect you to get it all, but this is a very easy way for you to actually read up on the things that interest you the most. So if you have your phone with you, if you're on a computer now and you have a phone with you, take out your phone for me, and you can actually get your own Elite MD app, and it's called My Touch MD. Once you download this app called My Touch MD, you are literally going to have access to information, everything that we offer at Elite MD, but specifically about fillers. There's probably about 10 different binders that you could read up on just fillers. So Juvederm and Restylane and Voluma and what's used where. There's video testimonials. There's how we do the treatment. There's more information on videos. There's you know, lots and lots of really good information I think that everybody would love to see. So my computer is not going forward. So what I want you to do is go to your app store and type in My Touch MD. And Elaine, I want you to actually bring up your slides, please, just in case mine got frozen. Oh, I got it. Here we go. Here's another way. You can also do this QR code right here. You can go to your phone and go to the camera section and just hover over this QR code if you'd like. And that will also automatically pop up the My Touch MD app. All you have to do is click on it, download it, and it will ask you for signing in with a password. All you need to say is forgot my password, and you will create your own password, and that will essentially open up the lock and key to get into the entire TouchMD informational binders that we have set up for you. You'll go under content, and literally there's probably about 30 or 40 different binders on everything we have to offer. Your key place is going to be injectables and fillers, or maybe non-surgical rhinoplasty. There's also another one on physician grade skincare that'll allow you to order literally in just a couple of clicks and read more about the products. This is essentially what I went over, this entire binder here. I just didn't go over very specifics in terms of brand names, but you can certainly look at more before and after photos as well here. So this is your lock and key to the vault of all the information that we possibly can give you, all at the touch of your fingertips. So make sure you download it, whether you see us in the near future or not, at least you will have the information at your fingertips. So please download the app. Ways that you can reach us, we are on all social media channels. Make sure you're following us, make sure you like us. We do a lot of giveaways there. We're gonna actually do a raffle, and if you guys are following us, you will potentially be able to win a free skincare product. More details to come in the next slide. I've also got a podcast, so it's not just about looking beautiful outside in, but it's also doing the work inside out. And so that's what my podcast is about, Dr. Sonia's 50 Shades of Beautiful, because we are all beautiful in our own skin, in our own right. You can read up on some books that I've written. Okay, here is where the action is. So for those of you who were so nice and kind to be here since the beginning and learn all this wonderful information, this is for you. We've got a couple of flash sales going on. You can decide what is right for you, or if both are right for you. If you were interested in part 1, where I spoke on the fillers, here's what we have to offer you. The first 15 that are able to come in and book for the procedure will actually get this wonderful, awesome promotion. We have limited spots, and it's only while supplies last. It will be with one of my injectable team of experts, and you'll basically put down a deposit telling us you're interested in the special, and you'll book yourself an appointment. Option 1, you basically get $300 off on any 2 family products. So if you like the Botox or Dysport, or actually Botox route with a Juvederm, it's an Allergan sponsored one, so it must be like a Botox and a Juvederm, or a Juvederm and a Voluma. We'll be able to help you with that. But basically, if you're looking to treat the upper third of the forehead and the lower face, this will be a good one for you. If you're like, oh, I don't need the filler right now, but I do like the fact that I could do the upper third of the forehead, you could do option 2. If you didn't want to do the upper third of the forehead, we also have fillers for the lower third, which we can tell you more about as well. So those 2 are the main kind of offerings tonight. All you have to do is let us know that you're interested by going to our website, EliteMDSpa.com. Go to contact us and fill out a little form saying that you attended Dr. Sonia's virtual webinar and this is what you're interested in. Or you can give us a call tomorrow. Would be the best time, around 9 o'clock onwards, because tonight you're gonna get our call service, who may not be as helpful. So 833 Dr. Sonia, write that down. Make yourself an appointment tomorrow morning. And it's only for the first 15, and the reason why is because the company is only allowed to give us that many, and it does expire after 2 weeks. Those rebate cards must be used, so the treatment must be done within 2 weeks. But we have other ones that could be a little longer out, maybe about a month out. Flash sale number 2. So if you're not ready for injections or needles or anything like that, or you've never had it done, you want to baby step it in, or maybe you've had it done, but you want to extend the longevity and you understand the importance of the basics. Skincare. We've got a 24-hour promotion on our physician grade skincare line. It will be 15% off on everything that you heard tonight. It is only available for 24 hours with this special code that is only available to you guys who have joined this seminar. It's basically code August AUG filler 15. Write that down. You need that to unlock your 15% off. You can order it yourself by going to our website, EliteMDSpa.com, and clicking on the store. Now, one added featured benefit, when you do want to go and buy those products, you can also lock in 15% off with Subscribe and Save. That's an auto ship delivery service. You can have it shipped to your house for your safety and convenience every 1 month, 2 months, or 3 months, year round. You decide what the schedule looks like. And the added bonus, I will be raffling off a free skincare product to one lucky participant who does buy any of the products and does a Subscribe and Save. We'll announce the winner on Instagram and Facebook on Monday, August 24th. So tune in for that. Okay, guys. So these are all the wonderful ways to reach us. Please, before you guys leave us, let us know how we did. Let us know what you learned. Let us know what you want for the future. call us tomorrow or reach out on our website and let us know any other questions you have or anything else you want to learn about. Let us know. We'll have one of our skincare concierge team members give you a call tomorrow. So I hope that you guys learned something, and I hope that you guys had a good time and you had your beverage of choice and you got a lot of information that will help you make a good decision for yourself. And I'm always available to see in the office for consultations on anything that you have questions about. Our team, I'm sure at some point, if you need anything, also, my team is fantastic as well, and they can also help you out with anything that you need. So we'll make sure that we get you to the right people and get you the results that you're after. So thank you guys from the bottom of my heart for joining us. I hope you guys learned a lot, and I hope you guys have a wonderful evening and a great weekend ahead. Let us know how we can serve you better in the future.
Thanks, Dr. Sonia.
Thank you, guys. Thank you,
Thank
Maria.
you,
Thank you.
All right, bye. Thanks so much for sticking with us.
Absolutely. You're the best.
Oh, you are.
Thank you. Bye-bye.
Bye-bye.
Thank you.